looking forward, I think there is going to be a reversal of trend, or there is an opportunity to reverse this trend. The trend I'm referring to is concentration of healthcare into the hospital. That has happened over the last 50 years because of diagnostics and treatment modalities that we talked about. Now, with the coming of AI, it is now possible to have, so what does, look, AI is a very complicated term, so I'll just simplify it. What happened in the .com time was all knowledge became available to everybody. You could go to a website, look it up. You don't need to go to a library or have access to a special textbook. You can look it up on Wikipedia. At least the entry-level knowledge was available to everybody, right? So that's essentially what the internet bubble did. What mobile did was one more thing, made it available on your phone. So you don't even need a laptop or a desktop. You can get it on your phone. And plus, it also did one more powerful thing. It connected 8 billion people through one 10-digit number. I can dial somebody in Brazil. I can dial somebody in Costa Rica. Doesn't matter, right? Now, think of it this way. Intelligence is available on the tap.
Absolutely, yeah.
What does that mean? What means that information is just an input into an action. So as a neuroscientist, and of course I studied this deeply, intelligence is not just problem solving. Intelligence is perceiving, making a decision on that perception, and action. It combines all three. So you are understanding what is happening in the world, you are doing some processing of that information, and then you are deciding on an action. So now intelligence which leads you to an action is available on a tap. That's the theory. Okay, now let's come to the practical. What does that mean for healthcare? We are now living in a time when chronic diseases affect almost everybody. If you look at the statistics, more than the age of 60, at least one, maybe two, maybe four chronic diseases will be there. Hypertension, heart disease, diabetes, pre-obesity.
Every family.
You take any country, you take India, which is a middle level country, you take USA, you take developed markets, it's there. Now, what does the hospital-based or a clinic-based model have to offer to that? Is come to me once in 2 months, I will see you, I will write a prescription and you figure it out. So that's basically giving some information, knowledge, but not action. What does AI make it possible? That you can now ask an AI agent, I am doing this, is this right or wrong? And that AI agent can monitor your sleep, your food, your physical activity, and say, hey, you are not moved enough, you are a hypertensive, you are eating too much salt, you are a diabetic, okay, you have this burpee, but then you make sure you compensate in the evening, I'll help you compensate in the evening.
More like a coach.
So so there is an opportunity to create solutions which allow healthcare to become health. How do you live healthier? Healthcare means first you fall sick, then come to us as a doctor or a hospital. Health means you are 30 years old, you are healthy. How do you want to be healthy till you are 70? And not fall into hypertension, diabetes, lung cancer, whatever, by the time you're 45, right? So there is now that opportunity. So what I predict happening is you will still need hospitals. Hospitals become more complex, more sophisticated, and you will only go to the hospital to have a major procedure, a major correction in your anatomy or your physiology, whatever is wrong with your, depending upon the organ system. But after that, you will go home fast, and then you will rely on these intelligences, whichever form they take. They could be coaches, they could be monitoring systems, they could be robots, like you mentioned, especially if you're elderly. Japan is already struggling with elderly care, and they are most advanced in robotics. So all of these intelligences in different embodiments will allow you to live a normal, healthier life for much longer than, our parents' generation has been able to. You are still a bit younger than me, so you will be a bigger beneficiary of this. But I am already 55, so I'm hoping that by the time I start reaching this threshold of getting chronic diseases, we have these guys, this army of agents around us, in whichever form that they take, who can enable us, empower us toward taking actions which lead to healthier life, not just go read a blog and find a recipe and cook, right? I mean, that you need a huge amount of motivation to be able to do that.